similarly, like for fetal spine, we'll do the acquisition of the fetal trunk from the anterior view, so the insonation has to be as much direct to the anterior wall of the chest and of the abdomen. So let's try to identify this view on our scan. So you can see that from this side, this wouldn't be possible because the shadows will occur from behind the ribs. And I will move the transducer to this side, over there, and I have my upper abdomen transverse view with the direct insonation. So I will zoom this area, and afterwards I plan to acquire a 3D volume. This is the 3D frame, as you know, from the previous examples. My settings is quality high 2 and the volume angle 50 degrees. I observe the fetus. It looks quite still, and finally I release the acquisition trigger. So now we can put the probe on a side, and we can work with orientation and afterwards with the review of the data set that we have acquired. So let's select multiplanar view. We have volume contrast imaging because we used it before. But here the slice thickness is too big. We have 20 millimeters. That's why it doesn't look so nice. Let's reduce the slice thickness to about 3 or 2 millimeters. So you start seeing the structures because the slice thickness is smaller, and the averaging of the signal and contrast is made just on the parallel layers. So I will make the orientation. I will use the spine as the landmark because this is a bright linear structure. Let's use the reference image A. Here I will bring my pivot point to the spine. I will make the Z rotation to bring the transverse section of the spine nicely. So it is ideal position now. And then I will bring the stomach to the left because you can see it is on the right side of my screen. So I will have Y rotation now. And I will check the position of the spine. So here I will expect a dot, a bright signal because of one of the trunks. And here you have the line of the spine in coronal view and another line in the sagittal view. I will correct a bit sagittal view, so the B plane. I will make it fully horizontal, like this. So now let's bring the pivot point in B to the level of upper abdomen, because you can see that this is the middle of the fetal trunk. Now I will try to demonstrate the use of tomographic imaging in the evaluation of fetal trunk. So let's select reference image A, and I will try to present in one screen all the representative sections through the fetal trunk. Here you see that the sections are placed just in the center, so I need to increase the distance between them, and I will reduce the magnification as well. So let's increase the distance, because at the moment it is 3.5 millimeters. Let's make it bigger. Here we can observe that at this point we can see urinary bladder. At the level slightly higher, you can see that two vessels are arising from the abdomen towards the umbilical cord. So these are the umbilical arteries. You go a bit higher to the upper abdomen, You can see it here very clearly in the asterisk section. And the position of the stomach in relation to descending aorta and inferior vena cava is very, very clear. You can go a bit higher and you start seeing the nice fourth chamber, and the position of the heart, the axis of the heart is very clear. You can present the fetal trunk in sagittal sections the same way. So let's try to do it. We'll select just the reference image B. So this is here. You remember that the distance in the axial cuts was bigger. Here we need to reduce it. Here we are. Let's magnify it and let's follow the relation between diaphragm and the abdominal organs. So here you see the stomach, and you see that the course of diaphragm is here. Here the same. Here you start seeing the liver, and this is the confluence of the systemic veins towards the right atrium. And this is the right side of the diaphragm with the liver on your right. Several years ago, Professor Akiron from Israel presented that coronal views are also helpful. So if you need coronal views for checking the diaphragm, you also can do it from one volume. Let's try if it is possible here. So I will select the C-plane and I will make it bigger. And see, let's move these sections a bit. And see the anterior part, anterior aspect of the diaphragm here, because this is the liver. Then you start seeing the stomach here, and you see that the position of the stomach is normal in relation to the thoracic organs like the heart and the lungs. As you can see, one acquisition of the fetal trunk has multipotential in evaluation of the internal organs of the fetal thorax and the abdomen.